We have a special treat in our coronavirus watch segment today, Philip. Would you like to introduce?
We have on the line right now Dr. Norman Matara, someone I know quite well, and someone whose medical opinions I respect. So there's just been a lot of misinformation going on social media that we've discussed, and I've had it up to here. I've had up to here, Dan.
It's unacceptable.
So I was like, you know what? Instead of us talking, let's get someone on a degree, some actual bona fides in the industry to just let us know what the hips and happenings are.
And enjoy.
All right, guys, welcome back to the show. And as always, we give you guys the best guests, the hottest acts on the continent, and the most knowledgeable doctors. Mm-hmm. And on the line right now, we've got Dr. Norman Matara, Secretary General of the Zimbabwe Association of Doctors for Human Rights. How are you doing, Doc?
I'm doing well, Phil. Thank you very much.
The reason why we invited the doc on the show is, as I'm sure you guys have been dealing with the past year, there's just been a lot of misinformation going around on WhatsApp. And in recent weeks, I've been seeing a lot more, not only false information, but concerning information, because it seems to be being pushed by doctors themselves. So I think, Doc, let's start there. Doc, what are the medicinal benefits of Kunatira?
Yeah, so it's I think we are living in an era where we have a new disease on the ground, which has been causing a lot of panic, and people are panicking on the ground. People are trying to survive, and there have been a lot of information of what can you do to try and survive, to kill this virus and to prevent yourself from getting the virus. And people have been talking about steaming or kunatira, as you say. But you see, there's been some studies that have been done about the benefits of steaming. So you will see that steaming is a little bit beneficial if you have mild symptoms. When you have got those symptoms, especially the upper respiratory tract symptoms, when you have got maybe blocked nostrils and things like that, and you can steam and get relief of mild symptoms. But what we know is that steaming will not help you from stopping COVID-19 from progressing from mild to severe disease. If you are in a situation where the disease was going to progress from mild to severe, steaming is not going to help you. But it can help you in terms of alleviating the mild symptoms, especially if you've got a blocked nostril. And also we are seeing.
Sorry, Doc, if I can interrupt you there. I just wanted to say, how do you know that? Because on WhatsApp I saw that steaming helps.
It might help in terms of alleviating symptoms from mild symptoms, but if someone has severe symptoms, it's not going to help you. It might actually make things worse, because when someone gets severe symptoms, like you are now getting shortness of breath, sometimes your lungs might be clogged. With COVID-19, it gives you like clogging of the lungs, which means that you might be having some fluids inside your lungs, which might be affecting your breathing. So you get shortness of breath, and if you start steaming, it might actually make things worse, because that steaming will increase even the fluid in your lungs, and it gets worse. So it helps in some instances, especially in people with very, very mild illness. But when people have moderate to severe disease, it actually doesn't help. It might actually make things worse.
Look, Doc, I think agree to disagree, because on Facebook it was very clear that steaming is a cure for coronavirus. So I don't know. I don't know where you are getting your information.
Yeah, there's been a lot of talk on Facebook to say steaming cures COVID-19, but that's a misconception, because at the moment we actually do not have any cure for COVID-19. What we do is we treat the symptoms, and we await your body to recover, by itself. So there is no cure for COVID-19 at the moment. And with COVID-19, almost 80 to 85% of people who get COVID-19, they actually recover even without medical treatment. You understand? So someone might think that I steamed and I recovered from COVID-19, but there is an equal number of people who actually did not even use the steaming, but still are recovered from COVID-19, because we know that from studies, 85% of people will actually recover without even any medical intervention. So it doesn't mean that because you steamed, it was the steaming that helped you, because you know. So yeah, steaming is not a cure for COVID-19. It may alleviate symptoms, especially if you have mild disease, but if you get moderate to severe disease, it's not going to help you. It's going to make things worse, and you have to seek medical treatment right away.
Okay.
So sorry, Doc. I'm just showing the viewpoint of a lot of people. I can see you looking at me like, what is this ignorant man doing on this interview? No, I was just speaking how some of the people out there speak. I'm not the one who personally believes that.
Yeah,
this is him all the time.
Yeah.
Did you see how he looked at me earlier? It was just like, what?
That's why I was laughing. I was like, he's like, what did Phil bring me into? Why? So before we get into the hot button issue, as Dan was alluding to, there are skeptics. You'll have people that say they aren't sure, even the doctors aren't sure, and we have evidence of this. Like last year, we had Dr. Anthony Fauci. Initially, he said that the disease would not affect America; it would burn out before it got to America. He was also on record as saying masks aren't necessary. Then he changed his viewpoint. So there are people who don't believe in the medical fraternity anymore, or their trust has been swayed somewhat by these events and others. What would you say to someone who is a doubter of the studies or the reports that are being brought out by the medical fraternity?
We are dealing with a new disease, so we will not know the effects of the new disease right away. We will not know. We will not have the facts right away. What we deal with is what we call evidence-based medicine, where scientists continuously carry out studies to try and ascertain the facts and come out with the facts. If you saw at first, I think around January 2020 last year, the World Health Organization, they actually announced that there is no evidence of COVID-19 being a human-to-human transmission virus. You see, but with time going on, with several studies going on, we actually ascertained that actually this disease is actually spread by human-to-human transmission. So we need to understand that it's a new disease. We are actually struggling at the moment as physicians, as scientists, to come out with the facts concerning COVID-19. That is why you see that there's a lot of talk regarding a lot of things, and even about the treatment. Last year, there was a talk of hydroxychloroquine, and we found out that no, this medicine actually does not work to prevent deaths or reduce hospitalization time. And at the moment, there's been a talk of different medication. But we actually await to see results from several clinical trials. Once we have results from different clinical trials, that is when we can actually recommend a treatment or a preventive measure.
Yesterday, in fact, no, it's 3 days ago now, a fraternity that calls themselves the College of Primary Care Physicians of Zimbabwe released a letter, an open letter that was addressed to Dr. Chimedza, who's the permanent secretary in the Ministry of Health and Child Welfare. And that letter was titled "The Urgent Request to Allow and Facilitate Ongoing Use of Ivermectin and Nanosilver for Treatment of COVID Patients." So there's a paragraph I'd just like to read out here for our listeners and for you, Doctor. It says, "Since August 2020, we have adopted the use of both Ivermectin and Nanosilver solution and have found this combination to be a game changer in terms of the management of our patients. A few South African colleagues who are desperate and also use the two in combination and can relate anecdotes of clearing an old age home hospital full of COVID patients in a week. They too were struck by the effectiveness and have actually put this protocol called SID protocol on the Ivermectin Africa website." What do you say to this? How effective are Ivermectin and Nanosilver? And also, what are they? What are those two substances?
Well, if I can answer what Nanosilver is, Phil, I'm sure you've watched those movies about werewolves. Yes, you need Nanosilver to fight off werewolves, but I think the doctor can explain the ivermectin part.
Okay.
Yeah, so ivermectin is actually an old antiparastatal drug that have been used. So antiparastatal is, as the name says, it kills parasites in humans and also in animals. So in Zimbabwe, actually, we do not. There are two forms of ivermectin. There is the animal form, which is given to animals, especially cows, and then there's the human form, which may be given to humans to kill parasites inside human bodies. But in Zimbabwe, we actually do not have the human form is not licensed. So we actually do not have the human form in Zimbabwe. We have the animal form only. This is the only drug which is licensed. So what the CPZ was advocating for was to use Section 75 of the Medicine Control Authority of Zimbabwe, which is a provision to which waives or gives which allows medical practitioners to procure medicines which are not registered in Zimbabwe to use if there is an emerging health condition, or if you think that that medicine works for a particular health condition. So at the moment, you see that we do not have the human form, and people are actually getting the animal form of ivermectin, which may actually be more dangerous. That is why the college was actually writing to the permanent secretary for the PEMSEC to give allowance for the human form to be imported and to be licensed here in Zimbabwe. Yeah.
Question. So in the paragraph they said since August 2020 they've been prescribing ivermectin. So you're telling me since August 2020 humans have been taking cow and pig ivermectin?
Yeah, so it's a mixture. I cannot say everyone who was getting ivermectin was getting the animal form. It's a mixture of some who are actually getting the animal form, which is the majority. Then there is some who are getting the human form, but it was getting into the country without due process. It was an unlicensed drug. So the human form was available here in Zimbabwe, but it's in very, very short supply since it's already an unlicensed drug. That is why the college was now trying to get license to make it procedural to get license for the human form so that it can become readily available. But I can tell you that the majority of people who were getting ivermectin were getting the animal form.
Sure.
I find this so funny because I used to rear pigs. And when we'd give the pigs the ivermectin, we'd have to, the Jackson, the thick white liquid, then bah. So you're telling me someone is bending over in a doctor's office?
Yeah,
Doc, I shouldn't laugh.
That is what desperation does to people. People are desperate, and everyone is getting anything that they may think works for COVID-19. But for us, we think that we are throwing away the values and the principles of medicine. Because when we talk about medicine, all the other drugs that we use, we talk about evidence-based medicine. In that letter that you have been reading about, they just say that since August we've been using this. But we conduct randomized control studies or trials, So in that letter, we were expecting to hear that we gave so much people, like we gave 200 people ivermectin or nanosilver, and there was another arm that we did not give the same drug. Then you compare the outcomes out of those two arms, and then if there's a clear benefit from people who got ivermectin or nanosilver, then we can conclude that it really, really works. But from that later, there was no such trials. If you see trials, if you read about trials, actually nanosilver has been shown that it actually doesn't work. There have been a lot of clinical trials that have been done. there is no clear benefit from Nanosilver from clinical trials. Ivermectin at least has some clinical trials that have shown some benefit from ivermectin, although the studies have been inconclusive. If you read today, even from England, they were saying that there is no evidence to approve ivermectin. They also do not have proof to say that it's not ineffective as well. That is ivermectin. So what they've recommended is that it's now between the doctor and the patient. You have to explain to your patient that this medicine is still under clinical trials. There is no clear benefit from this medicine. So I'm going to give you this medicine, but I don't have proof that it works. I don't have proof that it doesn't work as well. So it's your choice as a patient to take it or not. That is what is been recommended in England at the moment, until further studies have been done. But you see now, the problem with the college later is that they are advocating for something and they do not even want to conduct clinical trials. They say that we are too busy to conduct clinical trials. And to me, it doesn't make sense, because as scientists, we believe in evidence-based medicine. If we just want to say that I've been using this since August, so it works, then to me, we are not different from prophets or traditional healers, because that is what they also say to their customers, that I've been using this and it works. But for scientists, we need evidence, we need numbers, we need clinical trials.
In your opinion, doctor, then what is the reason for this request, this letter that came out? If you are interested in discussing that.
You would know with people now, people are in business, so you would think that maybe some people were actually benefiting from treating people using that, and they cannot be, they don't want to be stopped. Because for me, it doesn't make sense to advocate for something which has not been shown to show any benefit, unless you are maybe financially benefiting from that. But it does not make sense to me. Actually, this is just my personal opinion, and even my opinions of other clinicians that we've been discussing with on the group. It shows that some people might be actually benefiting somehow from that, but there is no drug in my entire career as a medical practitioner. I haven't seen any drug that has been advocated for without clear benefit from clinical trials.
Okay. Before we continue, what exactly is Nanosilver? And is that what the Terminator was made out of?
So that is another problem with Nanosilver. You see, the other problem with Nanosilver that makes it a dilemma for the medical council is that Nanosilver is not entirely classified as they are like when you classify drugs, there are drugs and there are things like supplements. You understand? So drugs are actually strictly things that are really controlled. Then there are things like supplements. The control of supplements is not as tight as that of medicines, which are classified as drugs. So Nanosilver, it actually falls under supplements. It's something that you can give to someone is just as in a supplement. Just like you can do like zinc, you can just give someone as a supplement. So people have been saying that if you nebulize with the supplement of Nanosilver, it actually gives benefit in terms of clearing your lungs and getting your oxygen saturation up. So I think that will actually become a dilemma for the Medicines Control Authority of Zimbabwe, because especially when you consider Nanosilver, because they do not have that strict control of things like supplements.
So it's like a powder, is what you're saying. What is its composition?
Yeah, it depends. I think it comes with in powder form or in liquid form. I'm not very sure about that. I'll have to check that.
So my next question then goes to, before this letter, there was another video, a series of videos actually doing the rounds. I think they said that it was the Hillside doctors, doctors of Hillside. There was a practice in Hillside that was advocating for this, and they were advocating for a COVID cocktail that included a number of medicines, including doxycycline, and people being put on a month-long cycle of doxycycline. What is your comment on that?
Yeah, that's the issue, and you have to link the two actually from the videos. I think the person who was involved in the video is actually a member of the college, of the CPCPs.
Ah,
Yeah. So it's it's like we are just talking about one thing here, and there's actually a clinical trial that came about 2 days ago. I'm sure you might have seen it. One of the biggest trials that tested doxycycline and azithromycin, and it came out that there is no benefit of giving those two antibiotics to people with COVID-19. It's actually one of the biggest trials of doxycycline and azithromycin. So again, there isn't any benefit of giving doxycycline and azithromycin from that clinical trial. We are actually worried, I think as public health physicians, that doxycycline and azithromycin, these are antibiotics. They were actually being taken by people as tweets. Everyone was selling from pharmacies in the street. You would get doxycycline and azithromycin as treatment or prophylaxis for COVID-19. Even someone who doesn't have symptoms of COVID-19, who is not tested for COVID-19, we're taking doxycycline and azithromycin. And it poses as a very big challenge because, apart from COVID-19, we're already facing a challenge of drug resistance, antibiotic resistance. And now with coming in of COVID-19 and people popping in antibiotics willy-nilly without any indication of antibiotics, I think after COVID-19, antibiotic resistance is going to be one of the global health challenges that we are going to be facing at the moment, to be facing in the future.
wow. Okay. So I think as the last question would be, as a medical professional, if someone suspects they have COVID-19, what should they do in terms of treatment? What would you advise?
Well, if someone suspects COVID-19, of course, what we advise is that if they have the symptoms, if it's possible, they need to isolate themselves away from their family, their loved ones. They then need to seek a test for COVID-19 right away so that we can prove if they really have the disease. And if the test comes out as positive, it will depend now with the clinical picture of the patient. If the patient has mild symptoms, they need to isolate and then to treat the symptoms. If you have got a fever, headache, or any pain, you take simple paracetamol, which can reduce the fever, which can reduce the pain. But what we really need to stress out is that if symptoms continue, or if they become more severe or they become moderate, like you are now starting to feel like shortness of breath, you really, really need to seek medical treatment right away. Because, of course, we do not advocate for people to just go to hospitals because they have COVID-19, even when they do not have symptoms, because it's a danger. You actually, maybe you don't have your own private transport, you go into the combis and everything, there's a risk that you might spread the disease to other people. So we actually want people to stay at home. But in as much as we want people to stay at home, we also want people to seek medical treatment early if the symptoms continue to progress. Because one of the reasons why people are dying right now in Zimbabwe is people are seeking medical treatment very, very late. what COVID is doing at the moment is it's causing what we call a silent hypoxia. So by hypoxia we mean that the concentration of oxygen in your body, in your cells, is going down. Usually when the concentration of oxygen goes down, you start to feel symptoms like tiredness, shortness of breath, things like that. But in the initial stages, COVID is causing a silent hypoxia, which means that the concentration of oxygen is going down, but you'll be feeling fine. So you think that, oh, I'm fine and everything. You are staying at home, you are doing the unatira things, ginger, garlic, zumbani, everything. And then when you start to feel symptoms now, shortness of breath and everything, it will actually be late sometimes. People are coming in with concentrations of 40%, 50% oxygen saturation, when the normal is supposed to be somewhere above 93, 94, 95, up to 100%, you see. So if you feel or think that symptoms are persisting or are getting severe, you need to seek treatment very early. Otherwise, there isn't much that you can do, and you need to know, like I said before, that 85% of people will actually recover at home without uh, without any medication. And if you have got what we call comorbidities, again, you need to be at the lookout. If you are obese, I think obesity is one of the risk factors. If you have got diabetes mellitus, hypertension, if you have got cancer, kidney disease, heart disease, or if you have got all those illnesses, you need to be on the lookout early, because you are at a risk of getting severe disease than other people. So you need to seek medical treatment, medical advice if you have those conditions.
Okay. I think that pretty much covers it. Dan, do you have anything else to add?
I think that's pretty much it. Thank you, Doc. What we're going to do is we're going to ask our listeners if they have any questions, if there's anything that's burning on their minds, to compile them for us. And then maybe at some time in the future, we can try to get you to answer some of those questions, if you don't mind.
Yeah. It's all good with me. Yeah, I'm sure it's actually quite good for us to respond to questions, because I've seen that most people, it's actually better to respond to questions. It clears the air, because there might be some things that we have missed during this discussion that people would be wondering about in their homes. So if you've got any questions, feel free to get in touch, and then we can try to answer to the best of our ability.
Okay. Sounds good to me. Thank you so much for your time, Doc. Really appreciate it. And